Healthcare is changing, and Dr. Nancy RN is here for you. The topics are many, but each program stands on its own with 3 key action points for you to learn. Your guide to a healthier you in a changing world. Dr. Nancy RN.
Welcome to Dr. Nancy RN. Healthy world, healthy nation, healthy you. I'm Nancy Valentine, PhD and registered nurse, and this show is dedicated to you, the healthcare consumer. And I'd like to introduce our guest today, Rita Numeroff. Rita Numeroff is a consultant at Numeroff and Associates, a global consulting firm working across the healthcare industry with clients in delivery of healthcare services, pharmaceuticals, medical devices, which are all those fancy machines and equipment that you often see in offices or in hospitals, diagnostic equipment. She works with payers, insurance companies, government officials, and policymakers. And she will probably share with us some very interesting stories because she has consulted to people on both sides of the aisle in Congress, especially around healthcare reform. She is the author of 5 books, including this book that we are going to be referencing today, her most recent book, 2013, Healthcare Act: A Turning Point, A Roadmap for Change. And this is a very interesting book, which you may want to take a look at and pick up, because when I read it, I said, I've got to interview Rita Numeroff for this show, because her specialty is interpreting healthcare reform. And as you know, that is one of the principal areas of focus for this show, to help make healthcare reform interpretable for people, you. So our topic this morning is that we're going to be talking about redesigning healthcare delivery, which is the intent of healthcare reform. And our subtitle is Hospitals Were Never Meant to Be Destinations of Choice. And I think we can all agree with that as a consumer. So I'd like to introduce again Rita Numeroff, and thank you for being with us today, Rita.
Nancy, it's a pleasure. Thanks for the invitation.
Thank you so much. Well, in this topical area, we're going to start with the basics. We're going to be talking about an overview of the current system of healthcare. Now, you may be familiar with the current system, but if you haven't been in the healthcare system recently, you may need to really think about our current system. And then we're going to talk about how reform is going to be impacting that and really fundamentally changing a lot of this. And then we're going to talk about what you can foresee down the road, how we are going to be looking at healthcare delivery in the future. So that's a tall order, Rita.
It is indeed, Nancy.
But you have so much experience, and I think that it's fantastic that you're out consulting with so many different organizations. And so you really see that 50,000 view of what's happening. So tell us, from your experience, what you see.
I think it's a great setup to the subject. Healthcare is probably one of the least understood and most important industries that will impact every one of us, regardless of whether we're healthy or we have health issues, or we have a lot of experience in dealing with some aspect of healthcare delivery. From my perspective, this is a situation where the industry has been in transition for a long time. It's been accelerating. And for the last 2.5 decades, it's been a focus for a lot of the consulting work that we do. And as you described in the opening, we have a lot of experience across multiple parts of the industry. And what I think most people don't understand and really need to is that this is big business. And it's in transition, and what that means is that it's engaged in changes in the regulatory environment. It has to deal with changes in the competitive landscape, changes in market expectations, and also significant changes in technology.
Okay, so let me just stop you right there, because I think when you say that healthcare has been transitioning for 2 decades, I think the average person in the United States says, isn't that mean that it's been getting better? Don't we have the best healthcare system in the world? Why are we changing this? I mean, you're now talking about all the things that are going to change, but let's just talk about that for a moment. When you say it's been changing, do you think it's been changing for the good, which I think is really most people's perception?
Right. I think that's a great question, and unfortunately, I think it's not been changing for the good.
Okay.
About 25 years ago, when the concept of diagnosis-related groups first came to be in the late 80s.
And tell us what that means.
Diagnostic-related groups essentially is the Center for Medicare and Medicaid's government pay attempt to lump a series of diagnoses together for which hospitals and subsequently physicians would get paid on a prospective basis. In the good old days, it used to be usual and customary rates. So whatever a hospital charge would it be, the insurance company would pay whatever was usual and customary within that particular region. And the costs of delivering that care were going in the wrong direction. They were going higher. And at that time, there was absolutely no connection between the services that were offered and the outcomes that were delivered. And most consumers weren't knowledgeable about that, didn't have reason to ask questions about that, and it was a major issue. What we predicted back in the late 80s was that with DRGs, which was the beginning of a prospective system, so essentially based on these groupings of diagnoses, hospitals and physicians would get paid prospectively. And so they were incented to provide more efficient, perhaps less service than was true before, because rather than getting paid on the basis of what service was delivered, they would be paid basically in advance, depending upon what the needs of that particular patient might be. And at the time, I predicted that DRGs would lead to more cost and poor quality. And at the time, people thought that I had flown in from another planet, and that I didn't really understand what was going on in healthcare. And unfortunately, my predictions have borne out.
Right, but let me just comment on that, because having grown up during that period of time with DRGs, I remember when they were introduced, the reaction of the healthcare community was incredibly negative, because that was seen as the first opportunity to put brakes on costs.
Right.
So the fact that it did just the opposite, it actually contributed to increasing cost, is very interesting, because what the medical community had not, and we're not just speaking about physicians when I use the term medical community, it was the providers of care, the hospitals, everyone sort of joined forces and said, you, the government or the insurance companies, are putting brakes on what we can do in terms of our practices, and we should have really no brakes at all. We should do what we think is best for the patient.
That argument was very much the centerpiece of what was going on for many, many years. And in fact, hospitals did very well under DRGs. Unfortunately, because there was no connection between payment for the services delivered and the outcomes that were achieved, we separated those. We continued to have these problems. And the other problem was that the consumer was nowhere involved in this equation. And so having conversations with providers about the kinds of services, what the options were, having any kind of transparency with regard to what the comparisons were from one institution to another was just not even part of the landscape at that time.
And there was no interest in that. It was really more like, what's in it for me as a provider, or what's in it for me as a hospital. There wasn't anyone looking at the big picture.
Exactly. Okay, so fast forward to where we are today. CMS, the Centers for Medicare and Medicaid Services, is very concerned about making sure the country doesn't go broke because of the amount of money that we're spending on health care. Unfortunately, we spend more than any other developed country in the world, and our health care services, in terms of looking at life expectancy and other kinds of outcomes, doesn't compare even to the top half. And so we spend more, but we're not getting the value back that we need.
And I think, Rita, that is so confusing to people, because again, when people say, gosh, we have the best healthcare system in the world, people want to be like us, they don't understand that this whole equation, which is really the underpinning of so much of this change, is that we are spending so much more and we're getting so much less. So let's figure out how we're going to translate that.
How we're going to fix this. So just before the recent law, the Patient Protection and Affordable Care Act came to be in 2010 with lots of controversy. And I'm not suggesting it was the right thing, but it certainly has been a major catalyst for a lot of the changes that we're seeing in the healthcare industry across the board. So device companies are being affected by it, pharmaceutical manufacturers, healthcare delivery, and so forth. So it's been a real catalyst. But before that law even came into being, CMS administratively said, we are going to institute this thing called never events. Now, it sounds like a very interesting and scary term, never events. And basically what it means is that there are certain things that should never happen when you're experiencing healthcare services in a delivery organization, whether it be in a hospital or in a surgery center or some other office. And things like hospital-acquired infections, things like operating on the wrong body part, or other kinds of errors, including medication errors. Those things shouldn't happen. There should be quality systems in place. And when they do happen, we shouldn't have to pay for those things or for the fix associated with that. And if you think about what happens in every other part of your lives, if there's a problem with a car or with a refrigerator or a television and you need to get it fixed, you wouldn't think about paying for the fix. You'd have real questions about whether you're going to use that particular manufacturer again. And so this was really fundamental shift for the healthcare industry. And it happened before the law even came to be.
I'd just like to comment again on that, Rita, because it's such a powerful point. And again, when people are not looking at that broader picture, you can sort of miss the forest for the trees. If you're a tree in that forest that had a bad outcome, the wrong body part operated on, or an infection because people did not wash their hands in the hospital, whatever those causes are, not only is it a bad outcome, but you actually are then billed. Now, you may not get that bill in your hand because your insurance company or Medicare or Medicaid has routinely paid these bills. But I think the point that you're making is really a wake-up call for the consumer population, which is really all of us, that we don't want to have any industry like that. Every industry needs to be accountable. But that whole issue of never events and that whole move to a more quality-focused organization is now 15 years ago. How are we doing? And is it really making an impact on our costs? But we're still paying for it, basically, is what I'm understanding.
We're still paying for it, but we're on the verge of massive change. And as I look at the industry, this is an incredibly exciting time to be in healthcare.
It really is.
Incredibly exciting. And consumers, I think, have an incredibly important role in making more demands and really being informed about what they need in this whole process. This is the beginning of a process of increased transparency and connecting payment to outcomes, being able to look at comparative effectiveness research, a highly technical term which basically says we want to be able to have data that compares what one facility does in terms of outcomes and having predictive care paths that engage consumers in that process and making sure that the practice of medicine is focused on the evidence that we know and the research that's available. And up until this point in time, it's really been more of a cottage industry where individuals who are qualified, who've gone to school, who have studied, have done basically what they're comfortable doing. And changing practice based on new technology is not something that has been easily adopted. And all of that is in the process of change today.
Well, let's talk about that whole issue and that term transparency, because a lot of people would not know what that term really means. In terms of transparency, it really has a lot to do with being informed, having information. So I think the first question most people will ask is, how am I going to get that information? Where's it going to come from? Do I have to go on the internet? Do I have to talk to other people? How do you see transparency really moving in the right direction?
I think that all of the things that you've laid out are the right solutions. There's information available on the internet through places like WebMD. Consumer Reports in the last 7 years has established an entire new business just focused on information related to outcomes and satisfaction and cleanliness and quality and infection rates with regard to what happens in hospitals. And they believe that this is a huge business opportunity for them. They would not move into this area if they didn't think that there was money to be made. One of the problems of just getting on the internet, if you don't know the source and the quality of the information that's there, it can be very misleading. And so if I had a bad experience in a particular institution, or I had a bad experience personally with a particular pharmaceutical agent that I was prescribed, I'm going to tell 3,549 of my closest friends on Facebook, and of course they're going to tell all of their friends, and this spreads like a virus.
Right.
But we need to understand that the reason I had a problem might have been that I took the drug improperly. I might have taken a double dose or a half a dose or with something else, and I had an interaction, or it may be because of my body chemistry, and it may have nothing to do with the quality of that particular therapeutic agent. So I think that we need to be really cautious about the sources and the quality of the information that we're gathering. And probably the best source is our physician and other care providers, nurses that we know and trust, that are part of practices where we go when we're not sick but we're focused on health.
Right.
So that this is not a situation where we're in a critical time where we don't have time on our side, but we've developed a relationship and that we have foundations that we can go to where we get the information in a reliable way.
Right. I think, though, you brought up a very interesting point, which I hadn't thought about before, and that is with all the social media, that's a whole other layer of transparency. Because even if you do have a conversation with all of your Facebook friends, or you tweet, it may be, this is my experience, it may not be the same for other people, but it does give alerts to people. It does start different conversations about what's going on. So I think that is another source of sharing experience.
Without question, it's another source of sharing. My only caveat is to understand what the quality is of the data that's being shared, because there can also be misinformation there too. So I think this is a really important input. There are other trusted sources. The government is now requiring that information about cost and quality is posted from healthcare delivery provider organizations, which is something that never has happened before. If you think about going to your favorite restaurant, there is typically a small sign in the entranceway, not too far from the menu, that posts what you're going to have as a potential meal and what the associated prices are, but also a statement from the health department about what the rating is from the health agency that comes in to certify that particular establishment. It has been extraordinarily difficult to get that same kind of information about healthcare delivery organizations, and that is being changed as well. And so there are mechanisms in place that allow us to be a lot more knowledgeable than we were before, but consumers need to take action and act as consumers and not as traditional patients who have been more passive and, quite frankly, have abdicated their responsibility in being informed and taking control of their own health.
Which I think is a very big focus of this show, and with all of our conversations, is really to help you be able to take those steps in the right direction. As Rita is telling us, the system is changing, and you want to be in step with the changes in a good way. Now, our subtitle of our discussion on redesigning healthcare delivery is that hospitals were never meant to be destinations of choice, and I don't think there's one consumer I've ever met that said, I just can't wait to go to a hospital. Most people don't want to be in hospitals, and if they are, they want to be in and out as quickly as possible. So it's not exactly a vacation spot that we'd be looking forward to, right?
It's not a vacation spot, but if you look at some of the institutions with their fountains and koi fish and glass and steel and art, you might think that they're modeling themselves after a resort. In fact, if you think about the delivery of healthcare services outside of a healthcare traditional facility with a bricks and mortar, when we look at the future, what I expect is that there's going to be much more technology and home monitoring and self-monitoring and reporting in when there are alerts going to physicians, whether they're in independent offices or they're working even within the traditional bricks and mortar of a healthcare delivery facility. We're going to have opportunities to get care and guidance telephonically, through email, and through a whole variety of other sources. And so that's fundamentally standing on end the traditional business model
of the hospital.
I
think what Rita's pointing out is very important in terms of just observing the landscape. hospitals really did build and are continuing in many communities to still build these very beautiful palatial buildings, and it's lovely to walk into them. They're extremely expensive. The debt to build these are 30, 40 years out to pay for these buildings, but that was really considered the competitive advantage in the marketplace. So if you as a consumer were deciding to go to hospital A versus hospital B, you were looking at things like, am I going to have a private room? Is it beautiful? How is the food? Not that they are bad indicators of what you want to take a look at, but they're going to become, what you're telling us, is really less and less important.
Right.
Because more of your care will be potentially at home or in community clinics.
Correct.
Of one type or another.
Correct.
How do you think that's going to fare for these hospitals?
It's creating a tremendous amount of angst, Nancy. I don't know of any healthcare delivery, academic or community-based facility anywhere in this country that isn't extraordinarily concerned about what this means. Boardrooms traditionally have been focused on what our daily census is.
Right.
How many patients do we have
Right.
in beds? And if you look at a situation where care is increasingly moving to less expensive, less intrusive, and quite frankly, safer systems, because when you go into a hospital and you're dealing with sicker and sicker patients, it's easier
Right.
to get other bugs
Right. Well,
that
there's
you
more
wouldn't
exposure.
want. Exactly,
Right.
exactly. So the facility itself is one that is fraught with potential problems. And so if you think about a different way of counting, a different way of looking at success and tying it to overall health outcomes of a population, a group of patients that this institution is now responsible for caring, not just about the episode that might take place in the hospital or in a surgery center or in the home.
Right.
We're talking about a fundamentally different equation. And there are some organizations that are really looking at innovative ways of delivering care. There's one example that comes to mind where there were some experiments that were going on, taking a look at the role of technology for non-high-risk mothers.
Mm-hmm.
They're typically mothers who had already given birth to a child
Right.
and were now in a second or third pregnancy. And so they were pulled into this experiment and asked to use technology that was offered at home to do fetal monitoring and a variety of other things, and to call in periodically. Initially, there was great angst on the part of this healthy group of women going through pregnancy because this was so foreign to their experience before. And once they got into the experience of calling in and not having to go to the hospital and navigating the thoroughfare, if you will, in the bowels of these very
Right.
large, complex medical centers, they found that this was kind of cool.
Right.
And they gave birth to their kids, and then all of a sudden now they were with these kids who were having to come back into the traditional healthcare delivery system because they didn't have the technology set up for the well baby checkup.
Mm-hmm.
So they were having to go to the pediatrician's offices with a lot of sick kids, and they began complaining vehemently about the very care that they had been accustomed
Right.
to getting before. So I
Right.
think there's some really interesting things on the horizon.
It's a very important point, though, in terms of shift of perception of the healthcare consumer. Because we all get into our expectations because it's based on our experience.
Right.
But when you have opportunities to experience something different, it may be, as you pointed out in that example, something initially that sounds like a negative, which actually turns out to be a positive once you've had that new experience.
But it creates real challenges for the healthcare delivery organization because now they have to look at how do we get paid for dealing with this kind of a service model, because our payer systems are not yet caught up efficiently to deal with that. And then you have to begin changing other parts of delivery. So it's a very complex road that we have ahead of us, but I'm very excited about it.
Well, you are. Your energy is really wonderful, and I'm sure that's what you express when you go out and consult and speak to your clients. I would like to also offer another example, which really wraps together the delivery, which is different, and the way it's paid for. So let me tell you about this.
Okay.
I was recently giving a presentation to a very large group of nurses and other healthcare providers in Virginia. And when I was speaking about examples of what we're talking about, how the system is changing, one of the participants, a nurse, got up and said that her daughter is now living in Switzerland, which, by the way, spends much less on healthcare and has rave reviews and very excellent outcomes. Okay, it's a smaller country, and we're not in this show going to go into all the reasons why that may exist. But her daughter was pregnant, had her first baby much earlier than the delivery date. So she was considered high risk. Right. She was in the hospital, excuse me, for about a week, at least a full week. And then for 6 months afterwards, she was visited on a regular basis by a nurse midwife for 6 months. Weekly, whatever she needed, she got. And this woman was saying, it was incredible. Right. She got such great care. She got Cadillac care, but at probably a fraction right. of the price right. of what we're spending, because she did need a lot of hospitalization, but maybe it wasn't in a fancy hospital. Maybe it was in a basic hospital where they had all that they needed. But what was so impressive was the aftercare by a highly experienced nurse right. that really could give her all the support she needed. So your point is that we really have to look at our own experience, our own expectations as consumers, and be open to the changes that the healthcare system, in our country at least right now, is trying to provide.
Right. And I think we have to be advocates for change. Too many individuals, again, abdicate responsibility. They don't ask the questions. They don't really engage in the kind of data and data review. And they're not speaking with their physicians and other care providers about, why do I need this test?
Right.
How is this test going to help me? And give you answers as a clinician to be able to give me better care. And so the idea of being in partnership with the care provider is something that's not been built in to the behavioral set of most consumers.
Right.
And there's a belief that somebody else is paying for it. So
right.
help me understand why I should be asking those questions. And we don't really appreciate how we're paying for the uncoordinated care that we have in this country through compressed wages, or not getting the benefits that we need in other areas, or increased cost of goods in the rest of our lives. So all of this adds up, but it's not been transparent.
Right.
It's a major cost driver.
Well, I just want to mention once again that Rita has done an incredibly wonderful job on this book, Healthcare at a Turning Point, A Roadmap for Change. And this is a book that's really looking at the high level of all the changes in every sector of the healthcare system. But I think what I'd like you to do, because she is at that 50,000 foot level, but I think in closing, I'd like you to give what you just said, the consumers, one thing that they could start with.
Okay.
What if all of your experience, and you're so practical and excited about the change, what would excite our consumers? What one first step could they take?
I think they need to enable themselves. You all need to enable yourselves to ask questions and not be intimidated by the system. No question is too basic or too complex to ask. In fact, most healthcare providers are scared to death about consumers. There's a big move around patient adherence to medical regimens and clinical protocols. Do you take your drugs in a certain way? Do they interact? Do you have a good lifestyle, and so forth? And so asking questions and engaging with data, being informed, and looking at options is critically important. And from my perspective, those are the ABCs.
That is excellent, a really great point, and something that you can take away from this show. I want to thank Dr. Rita Numeroff again for being with us. Rita is a Philadelphia girl, born and raised. In fact, she got her PhD in organizational development right here on the main line at Bryn Mawr College. So I want to thank you again. It's just been really illuminating to see what is happening from the lens of someone who gets around both nationally and internationally. So I want to thank you, our consumers, for being with us today. Have a wonderful day, and remember, with health, all things are possible. I hope you enjoyed our conversation today and that the information will help you in meeting your health goals. Catch this program and other conversations on the website, drnancyrn.com. Or you can write to me as well. I welcome your comments and feedback. Thank you for listening, and join us again. And remember, with health, all things are possible.